She'll talk about the structure of how a feedback should be and the different types of feedback. There is a feedback that you give just after a case. There you can be more comprehensive. Or you can have at times decide on a feedback on one particular aspect. So you can have either formative assessment or summative assessment. Summative can be as a planned session at the end of the year and talk about all aspects. So there is a mixture of things which can be done, and you have to target at that moment what is important and have it as a planned activity. So that is the important thing. It should be done frequently and it should be done at that moment when it is important, and it should also be done as a planned exercise. So we'll hear her and then we'll discuss what other aspects we can add. Can I have the audio connected? Please start.
So the objectives of this presentation are that by the end of it, we'll be able to explain the advantages of giving feedback, to describe the characteristics of a good feedback process, and to describe the process of giving feedback. Feedback is a process by which we let residents know how they are performing. The goal is that they change a poor habit, something that they are not doing according to our expectations, that they keep desirable behaviors, and that they modify, improve, and enhance performance. I will be referring to formative feedback, which is used during the process of teaching to improve learning, as opposed to summative evaluation, that is, the evaluation that we give at the end of a rotation or a term in order to assign grades or for promotion.
So, what happened? Why did it stop?
Feedback is a process by which we let residents know how they are performing. The goal is that they change a poor habit, something that they are not doing according to our expectations, that they keep desirable behaviors, and that they modify, improve, and enhance their general performance. I will be referring to formative feedback, which is used during the process of teaching to improve learning, as opposed to summative evaluation, that is, the evaluation that we give at the end of a rotation or a term in order to assign grades or for promotion.
Okay.
And this cartoon was actually created for training employees of a call center, but is actually a good example of how different formative and summative feedback are, and why it's useful to provide formative feedback during the process of training. So this employee here is receiving feedback from her boss, who is telling her, since you failed all your quality scores for the year, your annual raise is 0. Any questions? And so the poor employee asks, I didn't know we had a quality team scoring our calls. And the boss says, of course we do. The quality team monitors and scores all of our calls. And so she says, when do we get feedback of the results? And the boss says, you just did. So he provided her with feedback, but only at the end of the year. So she had no opportunity to change any behavior in order to get a raise in her salary. So the same is when we deliver feedback to our students. So the importance of giving feedback is that feedback enhances residents' performance. Residents get valuable information about how they are performing. They can compare their own impressions or their self-assessment with the assessment of you, the teachers, or the experts, and they get clear directions about what to do to improve. And this usually motivates them to perform better and better. But sometimes we find it difficult to provide feedback because we are very busy and we don't have time, or because we don't have enough information about a resident's performance, maybe because we are the program director and we haven't spent enough time with that particular resident, or sometimes because we don't know how to provide effective feedback, or because we are concerned about the consequences of providing negative feedback might bring about, like hurting the resident's feelings. So what happens when we don't provide feedback, or if feedback is inadequate? Well, first of all, valuable learning opportunities are missed when we don't tell residents what they should do better, because residents can't learn from their mistakes. And since they don't hear it from us, they might develop an inaccurate perception of their performances, thinking that they are performing better or worse than they actually are. So they will be surprised and disappointed at the summative feedback at the end of the rotation of the term, because they might not be expecting what we are telling them. Good feedback has 4 important characteristics. It has to be timely, it has to be specific, it should be constructive and positive, and it should be objective and relevant. Feedback should be provided soon after the event has occurred, so the resident can perceive the feedback is related to the behavior. And it has to be regular and frequent to provide timely corrective information, but not too frequent to be confusing or perceived as controlling. Feedback should be related to very specific behaviors or actions. General statements don't let them know what is right or wrong about what they did. So let's look at this example. This is good feedback. Your decision to indicate a trabeculectomy in this patient was correct. This is a very specific piece of information that we are delivering to the student. Instead of good job. What is good about the job? They don't know if we only tell them good job. They have to know what was good specifically about the job. Or, you missed examining the lens, specific piece of information. Instead of, I can't believe you made so many mistakes. They need to know which mistakes they made, not just to tell them in general, I can't believe you made so many mistakes. Feedback should be constructive and positive, because they will get the message better if we tell them what can be improved instead of what is wrong. For example, be sure to ask your patients about their family history. That's constructive and positive feedback, instead of you never ask your patients about their family history. This is negative and it does not take anywhere. Feedback also has to be objective and focusing on the action and the behavior, not on the person or on general statements. Good feedback. This is an example of good feedback. Yesterday you forgot to write the record. That's something objective, a piece of information, a fact. Instead of you are unreliable. That's describing the person. It's not good feedback. There are 2 ways of delivering feedback during the course of day-to-day activities, like seeing a patient or presenting a case or doing a procedure, and we call this informal feedback. It is verbal because we tell the resident about his or her performance, and also non-verbal because with a smile or a frown we also let them know if the action was appropriate or undesirable. Formal feedback is delivered through scheduled sessions at determined intervals. The steps for delivering informal feedback at the clinic or at the operation room are that we observe the residents do a procedure or the examination, and then we reinforce the correct answers and actions. We then discuss the items that need improvement in a supportive approach, and if necessary, we explain or demonstrate the right steps. We should avoid criticism in the presence of others, and especially when in front of the patient. We do not embarrass the resident nor alarm the patient. For formal feedback sessions, it is important that you first obtain information about the student, either by direct observation or provided by other faculty that work together with the resident. You should establish an appropriate environment, like your private office, where you will not be disturbed or interrupted, and the climate. You greet them warmly, you use a reassuring tone of voice and a non-threatening language. And you can start by asking a general question like, how do you think you are performing? Because this will make the resident feel more at ease and will provide you also with useful information of their self-assessment. There is a technique when you deliver formal feedback that is called the feedback sandwich, where you start with a positive comment like, I am very pleased with your performance at the operating room. This way the resident will not become defensive and will listen to the rest of the information. The negative feedback then is delivered. It should be specific, constructive, and objective. It needs to have all the characteristics of good feedback. For example, you need to improve your explanations to your patients. And following this, the resident should be encouraged and receive clear directions of how he or she is expected to go on. I am sure you will be able to do this the next time. And all this technique is called the feedback sandwich. And in summary, it consists of positive feedback, the negative part, and end with positive again. Finally, it is important to develop an educational plan for closing the session. It's important to set the objectives. For example, next time I need you to focus on this part of the exam. Recommendations should be realistic. For example, you will communicate better with your patients if you greet them with a smile instead of telling them, don't be so formal. This is something that maybe the person can't change, but he or she can change the way he greets the patient. And this is something that it's possible for them to improve. And also it's important to document what has been discussed in order to follow up in the future. So in summary, letting residents know how they are performing helps them improve their performance. For effectiveness, feedback has to be constructive, objective, specific, and timely. It is advisable to combine informal feedback in daily activities with regular sessions of formal feedback, when it is recommended to start with a positive comment, move to the negative comments, and end with encouragement and directions. Thank you very much for your attention. This is a very good paper about how to use effective feedback to facilitate adult learning. Thank you very much.
So I think it was self-explanatory. So it has to be constructive, it has to be positive, it has to be specific, it has to be objective, and it has to be reinforcing the good things in the candidate, and have both day-to-day as well as at the end of a session, end of a posting, end of a year, so that then you convey the overall impressions of how he is developing, and so that he has an opportunity to understand how he is and he can have the opportunity to improve. Yes, your comments, Prashant, and then any comments from all of you.
I think while in Western world these feedbacks become a part of their life, we as a teacher in Indian scenario face two major problems. One is that we often lose temper whenever we see a mistake, and that really lead to demotivation among learners of any kind. Number two, I think we often become non-specific. You are not doing good, and we lose the whole perspective. What I am not doing good. And it will be very important that I think if these two principles we learn from today's lecture, I think that will improve automatically the way we give feedback, and it will help tremendously in enhancing the performance of the trainees also.
So, as he's emphasized, maintain that constructive relationship, that he learns to rely on you, on your feedback, because he knows that you will not be unnecessarily negative and you will not be scolding, but you will be giving positive, constructive thoughts. So if you can maintain that kind of relationship with your residents, then it always helps in building up the right and have the right observation. This also gives them a lot of strength that you are at least thinking about them, that you are giving them time. So this also is a very positive. I think experienced teachers can.
Sir, we are working with high volume. That is the biggest problem. We don't normally. What practically we do is that we have 300 OPD, and in 3 hours time we have to work, and many a time it happens that we don't talk to the patient, we don't talk to our resident also. We keep on screening the patients, how many cataracts are there, how many squints, and if interesting cases there, we sort it out. And then the resident keeps on thinking that he has to do the biometry of 60 patients. The boss will go away, he will have a cup of coffee, and where is the time for the feedback? That is the biggest problem. And if we have the same number of patients that they have in the Western world, we could be a much better teacher.
So we have to adapt to our circumstances, but we have to remember that we sometimes have to make time out on some occasions when we can sit together for some reason to give that kind of feedback. So our occasions may be more different. It may not be possible in a... So we have to adapt it to our circumstances, and that is a very, very practical point.
So end of the day, 10 minutes with residents, and early morning 10 minutes with the residents, believe me, they do wonders.
Yes.
In the morning, once we tell them that what do we expect in the day, and after the day is done, this is what you've done really good and not good, that you tell me what you've done not good. So
And that building of that rapport, that teacher-student relationship.
whatever problem, put on the WhatsApp, send it to me.
So once they know that you care for them, the kind of things that you can get done out of them is amazing. If you spend a little time which they think you are spending for them, that you are purely spending for teaching, even in spite of your schedule or talking to them, it brings out so much good from them that you never get a negative complaint from them. And then you find them so much better at all the work that you want done of them.
If I can chip in here, I was looking at this video. Gabby and me were together at the University of Michigan. There's a whole lecture on how to give surgical feedback and how to give this thing. So anybody is interested, you could go to University of Michigan site. There are courses on Coursera. There are free courses over a period of 8 weeks. You can do how to give feedback, surgical feedback and things like that. But one of the things that happened that we were listening, Gabby was listening from other than, we were talking to each other, and this audio was going on about the feedback from Michigan, and my wife chipped in from there and said, "Agli baar shayad mujhe bhi feedback acha milega." So technically what happens is that we give feedback every minute. So I was just trying to say, we give feedback every minute. We give feedback to our child, we give feedback to our wife or husband. The feedback is always there. तुम तो कभी कुछ करते ही नहीं हो, तुम तो कभी कुछ लाते ही नहीं हो, सारा काम तो मुझे ही करना पड़ता है. So these are all feedbacks which are coming at the drop of a hat every minute. It's only thing that we have to bring it into our consciousness that I am giving a feedback right now, this could have been better. So that's what needs to be done. So maybe there is time within the madness also, because that keeps occurring in every minute, even at our homes.
Exactly true.
Already he has explained. Actually, feedback system is there in our country very well. But only thing, whether we are giving feedback is a separate session like this, nothing else. Otherwise, then and there the feedback is there. Maybe sometimes negative feedback sometimes. Otherwise, feedback is there even long back also.
Yeah.
No, I fully agree that there is a feedback. But what I'm saying is that it should have a very defined objective. What is the action that you want? What is the change that you are expecting in the? It should not be generic. You are bad.
And that effort to really make an assessment of an individual and look at his positive points and negative points. That a little thought towards that is very helpful.
Feedback is like,
so, we should not be judgmental. Instead, we should be very objective. And all of us should take some dedicated time off our busy clinical schedule, dedicated towards structured teaching and giving feedback. That would go a long way down in improving the quality of postgraduate training, I guess.
There's something called 360-degree feedback. So there are several components to it. Then you take, then there's teachers' feedback. There are so many other elements that the teachers also need a feedback from the students as to how they are doing, and a relative grading of the entire staff, which helps you, gives you the motivation to be better, to improve. And then there is a 360-degree feedback where you take feedback from all the people he works with, other residents, staff nurses, OT assistants, and the entire scenario of place where he's working. So all those things are built in. We kind of do them in a way, but we really need to understand them a little more and give it a little more formal thought so that we can improve these processes of developing a resident's best potential.
I was just going to say Prashant was part of the 360-degree evaluation tool that was recently published. So we have him right here if you want to ask any questions of how to go about doing a 360 degrees. As we move on, I'm going to have you all stay there with the people joining there. We're going to request Mr. Sivanyanam from Appasamy to spend the next few minutes talking or giving a tribute to ophthalmic teachers. As you all know, no successful program, especially in education, is possible without support. And the central program has been followed by zonal program for the last 3 years, 10 zonal programs in different parts of India, which has drawn quite a bit of success. And these zonal programs are going to continue in this coming year, where we are going to have, hopefully draw medical college teachers who are unable to attend to come and join in these kind of seminars.
I have a good news that after a lot of years of pushing, this year the management committee, GC, has agreed that for the teachers from government medical colleges who travel to those zonal programs, taking time off and from a distance of 100 kilometers or more, will be given a compensation of up to about 4,000 rupees.
That's wonderful. Great news.
So that they are able to come, because otherwise they have to spend on their own, and it was take time off from their work schedule or whatever. So it was very difficult. So I think this we were pushing for several years. I had been writing to the president, and they had agreed in principle 3-4 years ago, but this has been formalized now.
Wonderful. That's
so
great.